Hi there, everyone. Gary Coleshill here, and welcome to Obamacare, also known as the Marketplace Explained. My name is Gary Coleshill. I'm a licensed and registered agent. That basically means that I've taken extra educational courses to better understand the marketplace and pass an exam to demonstrate proficiency. I'm also listed on the marketplace website, somewhere on my zip code of 85254. So let's get started here first with the traditional disclaimer, and here it is, or rather, here they are. We are not endorsed or affiliated by the US government or the federal Medicare program, or I guess the marketplace either. The information that we'll cover represents our current understanding of Social Security and should not be considered as tax or legal advice. Please consult with an enrolled agent, a CPA, or an attorney before implementing any of the strategies discussed therein. Now, no part of this presentation is intended to make an offer of sale or purchase of any specific security or insurance products. We're just here really to give you information and kind of explain how Obamacare works as simply as we can, and then we leave the option up to you what you do with that knowledge. Obviously, you can always call us up afterwards if you have any questions. So, moving on, and this is pretty straightforward. It won't take too long, so don't overthink this. So, what is Obamacare? It's a government-regulated healthcare platform where you can buy health insurance. Big deal, right? Well, actually, yes, it is, because the government, more specifically, the Obama administration, wanted to make healthcare more affordable and accessible to the general public. So Obamacare was created, and even though it's not perfect, it's actually pretty good. And up to its introduction, you could be denied health insurance for having a pre-existing condition, that the insurance companies didn't like, but basically because they cost them money. So people were being turned down for having illnesses like, cancer, heart disease, having a stroke, diabetes, and many other conditions that could cost the insurance companies money. In other words, the insurance companies were cherry picking because they were allowed to do so. And there were financial caps also on how much money the insurance companies would have to pay out. So even if you already had insurance, if you became ill after a little while, you probably hit the cap, and then they wouldn't pay out for you anymore. Now, Obamacare did eliminate pre-existing conditions and capping out. So, they're obviously good things to do. So that's a positive. Perhaps a little bit on the negative side, because the insurance companies have increased their risk, they've also put prices up quite a bit. But that's somewhat addressed in the next section where I talk about subsidies. But insurance policies have definitely got more expensive as the insurance companies obviously took on a lot more risk with pre-existing conditions and with no cap. Anyway, Obamacare policies come in four different flavors. Well, actually, not flavors, they're types of precious metals. There's bronze, there's silver, there's gold, and there's platinum. Now, each level is based on coverage and cost. For example, bronze is the cheapest and covers the least. As you can see, bronze covers about 60%, silver 70%, gold 80%, and platinum 90%. Each level has policies from different providers, basically competing for your business in your area, and you can compare coverage and cost side by side. Now, you don't have to be a brain surgeon to figure out here that basically this is a matter of risk tolerance, let's say, or maybe health tolerance against cost. If you're young and you're fit, you may well opt for a bronze or a cheaper plan, one of the cheaper plans out there, because your risk obviously is not as great of being seriously ill, even though it can happen at any age. So, as you get older, you're probably going to want to opt more towards the more precious metals, let's say, because the chance of you being sick are higher. But it's really a risk tolerance. How much risk can you take? Is it worthwhile to save money by having a lower premium, knowing that if anything does go wrong, you've got to pay more out of pocket? So that's very much a personal and unique to you decision to make. So bear that in mind. Though people tend to, as they always do, go towards the middle plan. It's just human nature, I guess. The ones that are not too expensive and not too cheap, like Goldilocks. Anyway, should call them Goldilocks plans. Regardless, that's kind of how they work anyway, and you can get details on any of them by going to healthcare.gov. So, what is next? Actually, have we covered that? Maybe we missed something here. I think we were going to talk about sponsorship, the subsidies. Basically, one of the great things about Obamacare is the government did want to keep costs low, so they did arrange for a somewhat complicated system of subsidies for people with lower incomes and with families, so that they could afford healthcare coverage, even though it's been a little bit affected by to say the least, by insurance companies putting their prices up. It's still very, very good, and you'd be surprised how many people actually get subsidies to help them pay towards their healthcare costs. So when you fill out an Obamacare application online, which is presumably how you do it, there are questions in there about your income, and very important to remember, especially if you're in an area like being self-employed, where your income can fluctuate, that you estimate as accurately as you can just how much money you're going to make in that particular year. Because if you underestimate how much money you're going to make and you make more, you may end up owing money back at tax time. And if you overestimate, you may end up getting a refund at tax time. So bear that in mind and try and fill it out as properly as you can. So what's next? Well, you can find out if you can get health coverage right now. Usually with Obamacare, you have to wait till the open enrollment period, which I believe is somewhere around the 1st of October to the end of the year. There's a couple of months there where you can apply for it. Everybody can, and basically can't get turned down. You certainly can't get turned down on pre-existing conditions. You obviously you have to figure out which plans work for you, but that's a great time to apply, obviously. But a lot of people don't realize there are a lot of, quite a few anyway, of special enrollment periods for Obamacare. And basically that means that you can hop into an Obamacare plan in your own special enrollment period. Now, special enrollment periods are usually due to you if you have some kind of major life change. If you basically lost your healthcare insurance, if something happened to you that changed your position, maybe lost your job, maybe moved away, maybe your insurance company closed down. There are quite a few reasons that you can get a special enrollment period. In fact, there was one recently for Arizona for, I'm not sure what county it was now, but there was one because of forest fires. where people got a special enrollment period, because if they wanted to basically make changes in their healthcare policies, they couldn't because of the fires, apparently. So, there's quite a few of these things around, and the way to find out if you qualify is go on Obamacare and just go through the questionnaire. It's pretty simple, takes about 15 minutes. By the time you've gone through it, you'll know what kind of subsidy you'll get. You'll know if you're entitled to any special enrollment periods or not. And then if you're not, then you might have to wait till beginning of October. And you'll see also what's on offer. So that's what I would highly recommend, is jump on to the healthcare, the marketplace platform, go through it, answer a few simple questions, very, very, very easy to fill out. If you need any help at all, I'll be happy to help you with it. You can enter it through my portal, which I've got up on the screen there, which leads you directly to the marketplace and to their questions. So just go to tinyurl.com/ACA, which is Affordable Care Act, -peak. And that will take you to it, and you can run through it. No obligation, no cost, no insurance agents are going to call you. The only insurance agent that might call you will be me if you requested it. So it's a nice, simple, peaceful process. You're not going to have 200 agents ringing your phone off the hook when you put it out, so don't worry about that. I did that recently with car insurance. Made a mistake and went on to a site to get a few quotes, and my phone was ringing off the hook for a week. It was really annoying. Don't worry, that won't happen to you here at all. You can fill this out and no one's going to bug you, and you can see what you really get. Okay, so that's pretty much it. Unless anybody has any questions, I can be reached as usual on my toll-free number 888-894-2929. Remember, I do have some proficiency in this. I'm a marketplace registered agent who can help individuals with applying for and enrolling in marketplace coverage. If you want to email me, my email address is garyc@eliteprospeakers.com. So that's pretty much it. I told you, pretty short and sweet. Again, if you need a quote, want to find out more, go to tinyurl.com/ACA-peak. And that's it for today. If you need me in any way, give me a call. Again, 888-894-2929, and thanks again. Enjoy the rest of your day. Bye for now.